I'm going to show you the method I use to teach diaphragmatic breathing to EILO patients. I have used this approach at the end of countless evaluations to look at stimulability. And in, I'd say, less than 3 minutes, most of the time the patients have a good sense of what they need to change. So I'm going to break it down for you about the how and the why I use this method, and then I have a video where you can actually see me using this approach on a patient. So most EILO patients, they're breathing from the chest, and their breathing is they're either breathing too frequently or too much volume, or they're stacking their breath or holding their breath, or some combination of all of the above. And what they need to learn is diaphragmatic breathing. That's one of the components of what I use to teach the therapy for EILO patients. And that's why I create these 4 simple steps to teach diaphragmatic breathing in the stimulability section of your evaluation. So step 1 is vertical versus horizontal breathing. What I tell the patient is, most of the time they're breathing vertically. I can see that they're breathing this way, up and down, instead of side to side, and they're breathing from their chest. And so I educate the patient that when you're breathing from here, it's not very efficient. It's this either accessory muscles or the intercostal muscles that they're using. What they really want to use is the primary muscle for respiration, which is the respiratory diaphragm, which, as we all know, is attached to the lower ribs and also at the sternum and also in the spine. But what they need to learn is that as that diaphragm contracts and lowers, the ribs move out to the side and giving rooms for the lung to expand. And that is where they're going to get a lot of power for their breathing. And I tell them that actually when you learn diaphragmatic breathing, that diaphragmatic breathing is going to become one of your best friends to help you in overcoming your symptoms. Step 2 is you place your hands on their lower ribs. I find that when you ask patients to put their hands on their chest so they can feel themselves chest breathing, most of the time they can't feel it. They can't feel it. They can't feel it if you put them in front of a mirror. Even though it's visible to you, they can't see it. They can't feel it. So instead, with their permission, you place your hands on their lower rib cage. And this works because of the tactile cue. Okay? Step 3 is the spot more than the size. One of the things I communicate to the patient is that they need to be breathing small, slow, and silent. So I help them learn what normal breathing should feel like. Because at rest, there shouldn't be a whole lot happening. There shouldn't be a whole lot of movement. It's not that I want them to take a big diaphragmatic breath at rest, because that's not how we normally breathe at rest. There's very little going on. And it also helps them it takes the pressure off of them to take a deep breath. It's not like, when you go to your doctor for your annual exam and they want you to take a deep breath. We don't want that at rest. We want them to just feel what it's like to take the breath from a different spot, And then step 4 is you're having them breathe into your fingers. So I tell them you want to breathe sideways. Think of your breathing going this way, and that the chest wasn't invited to the party, so to speak, that they're just breathing low into your fingers. And you want to have them let the breath occur. Tell them to let the breath occur. Let it just kind of happen on its own. Sometimes I have them kind of close their eyes so they can just kind of let the breath happen rather than trying to make it, force it to do something. We definitely don't want them to push their belly out or their ribs out. That's not what we're talking about here. But this works because they can feel the movement of their ribs against your fingers. So these 4 simple steps work, and I would suggest just take a few minutes at the end of your evaluation in the stimulability section and try this. It probably will take less than 3 minutes, and see if they can do that. And in the meantime, try it on yourself. Do these things on yourself, and you'll probably notice that the breathing will start to feel calming, that your breathing, will be slow, small, silent, sideways. okay? If you're trying it with your patients and they're saying, well, that feels weird, or it feels different, or it's weird, that's great. That's great, because that means something has changed. They're not going to be used to breathing low, but it's going to feel different, right? And that's just what you want, is that it's going to feel different, and that means that they've changed something. They've started to experience a change in their breathing pattern, and again, getting some control over this EILO. So, as I said, in the meantime, though, you can try it on yourself and see how it feels for yourself. And now let me show you the video so you can see exactly what I'm talking about. But to use this area for breathing, we call the chest or accessory area for breathing. But I want you to use this area here from what we call the respiratory diaphragm.
Oh, I learned about this.
Yeah.
You, like, push it.
No, but here's the thing. So put your feet apart a little bit. I don't want you to like push it out. You gotta think earthy crunchy. You gotta think, let the breath occur low. Don't think push out and pull in. Okay? Yeah. So you're just going to kind of let it happen. So is that okay for my hands? Mm-hmm. Okay, good. So you're going. So you have a tendency to want to go up and down with your breathing. I want you to go almost like sideways. Mm-hmm. So from the lower ribs and here, but you're going to kind of let it occur. So you kind of just. So you're going a little bit in the reverse direction. So let me come behind you. Okay, take a step forward to the left. Okay, so you feel where my hands are here. Mm-hmm. You're going to, usually I do a little differently, but you're standing. Okay, so here are ribs, right? Mm-hmm. Okay, so close your eyes for a second if you can. And I want you to just kind of, when you take your next breath, you want to breathe like into my hands. So your ribs expand. Yeah, okay? So you're breathing sideways. Now that was a big breath, so you don't normally need to breathe that big a size, but it's the location that I want. Yeah, so it's smaller. And now see if you can allow it to go even a little lower. Yeah. Mm-hmm. And if here, what you feel is it's going to come a little bit outward. And your breathing should be silent. So you shouldn't hear it. Yeah. So see if you can slow it down. Yeah. Mm-hmm. So you just kind of want to think about letting it like a snowman. And just kind of letting this relax. You see, can you, when you take your next breath, can you breathe into my fingers? Mm-hmm. Hmm. Now, if you found this video interesting, or if you have questions, please put them in the comments. Please put them in comments. I read every single one. Or if you're interested in learning the P.I.E Approach Level 1, which is a self-study course for speech-language pathologists on treating EILO, there will be a link that I will put in the description section. So if you like this video, please, hit thumbs up and subscribe, and we'll see you in the next one.